Thank you for joining me, guys. I think, as we did before, we'll start off with some introductions. Vika, could we start with yourself, please?
Hi. I'm Tembeka Stemela Dagbo. I'm a fund manager for M&G Investments, where I overlook the Diversity and Inclusion Fund, where we invest in companies that are demonstrating high levels of diversity, but also those companies that are creating solutions that are bringing about social equality in their communities. I'm also the Deputy Fund Manager of the Positive Impact Fund, where we invest across different impact areas from the environment, circular economy, and of course social impact as well.
Thank you. Jess.
Hi everyone, I'm Jessica Attard, so I work at Share Action and I lead our growing programme on health. So Share Action is a responsible investment NGO, and my work is really all about working in partnership with investors to hold companies to account for their impact on people's health.
Thank you, Jess. Thank you. And finally.
My name is Maria Larsson Ortino, and I'm one of the global ESG managers at Legal and General Investment Management. So I work in the stewardship team together with my colleagues across the investment floor. And I focus health is one of the themes that I focus on.
Good. In the right place. Thank you.
Yeah.
Good. And just let you know that Gustav from London Civ was supposed to be joining our panel, but he's also elsewhere with us today, but that's okay. Tembeka, could we start with you, please? What opportunities are there for investors who want to make a positive social impact?
I think we have touched on a few already. But I think, put simply, for investors, it's really just about backing companies that you think are driving social impact. And by that we mean, having products and solutions that are helping to empower the communities in which they serve. So that could be anything from, backing microlenders that are, providing financial inclusion at affordable rates and not creating indebtedness, for instance. Or companies creating or having vital infrastructure in economies to drive, whether it's greater mobile penetration or telecommunication services, etc. And I think what's important when thinking about social impact is there's definitely a long-term outlook that one needs to have in terms of understanding how these outcomes will come to bear over a period of time. And so one can do it from a company-specific perspective, but recently, at least over the last 5 years, you could also do it within a fund. So you have seen the emergence of a lot of impact funds coming out that might not just be looking at environmental issues, but are also tackling social inclusion as well. And more recently, there's also been a bigger focus as well for more social-orientated funds that can actually come up with a bucket of companies who are driving social change in their societies and in the countries in which they operate. So that's probably an investable way to do it. And I think more interestingly is that, with the emergence of Article 9 funds, where you can actually create a dual objective, where it's not just about financial returns, but also about evidencing the sustainability elements or the positive impact that has been created by the holdings within these funds. That's also a good way that investors can look into social outcomes, but also keep fund managers accountable to ensure that they actually are investing in companies that are driving change. And that's because there'd be annual reports that would have to dictate how that fund has created that social impact as well from a year-on-year basis. So I think there are a lot of creative ways that the industry has found for investors to actually start investing in social impact. But outside of that, and this is something that we've already touched on, engagement also remains key. It's very important that companies understand that in creating renewable energy, they're also limiting any negative externalities they might have from the social side. And it's our responsibility as investors who are wanting to think more from a social perspective to be able to use our management access, to be able to use our votes, to make a call so that companies can, to drive companies rather, or push companies to do better on the social front for their employees and for the communities that they're serving. So there are really very many different ways that one can tackle social impact, whether it's directly investing in companies, investing in funds where they could also hold the fund managers accountable, and also by using their voice as investors of any company, really, to reduce any negative social externalities.
Thank you. Very comprehensive. Thank you very much for that. Thank you. Jessica, I mean, how has the pandemic changed attitudes towards investors making a social impact?
Yeah, so I think it's fair to say that pre-pandemic, and still to some extent now, social issues have always taken a backseat compared to environmental issues. And we hear a lot from investors that that's for a few reasons, and that's partly because social issues have historically been less well defined, they've been less well reported on by companies, and it's been more complex and more difficult to make the link between social issues and financial materiality. But I think what we've seen is that investors have started, particularly since the pandemic began, to really pick up and start to run with social issues, and particularly health being one of those social issues. And I think partly that's because we've seen over the last few years this idea that social issues, although it's perhaps can be more difficult to make that direct link to financial materiality, we've seen real tangible examples in the real world of how social issues can really affect companies' bottom line. So whether that be take Boohoo and the allegations of labour rights abuses, which wiped £1 billion off its value. A more recent example is Kellogg's, who, by their own modelling, have said that particular UK-based regulations coming into force would cost them £113 million per year in lost sales. And so we're seeing these social issues really play out into those financial materiality for a lot of companies. And particularly, of course, the pandemic is a real live example of that. So the global economy shrank by 4.4% in 2020. And of course, many companies were financially affected by what was a public health issue. And particularly, not least, of course, the hospitality industry. So I think we're really seeing the pandemic has shone a spotlight on the link between social issues and financial materiality, and we're starting to see S factors rise up the agenda. That includes workers' rights issues, living wage, sick pay, vaccine equity, and of course nutrition and health. And certainly from a Share Action perspective, we have a programme that focuses on the nutrition side of things, so working with food companies to improve the impact that they have on their customers in relation to their diets. And we've seen a huge uplift of investors coming to us and wanting to join our coalition and to really be part of driving that forward.
Thank you, Jess. Thank you. Maria, Jess just highlighted there that the social aspects of ESG don't quite get the attention that the environment has in recent years. I mean, do you think the pandemic has increased the focus on the S for investors?
Absolutely. I think it's a perfect question following on from what Jessica just said. I think it definitely has made it possible, in a sense, for us to focus more on it as well. And I can see it both internally, externally, questions from clients, but I would say also by general stakeholders, including our own companies and us as shareholders, and evidencing what Jessica was just saying, what Share Action is doing as well. And I think when you come and look at the S, for us, it means the human capital management, it's income inequality, diversity, and of course health, which is the area that I focus on. And so I think for these, human capital management, income inequality, and diversity, it has further increased the possibility of focus on this, and the willingness both from our companies and our clients to do more work on that. And then if I look at specifically the health area that I work on, we can look at two things which have been immensely helped, if one can say that's the silver lining almost of the pandemic, by the impact that COVID has had on the whole of society. So the two areas that we look at is antimicrobial resistance, so AMR, and nutrition, and we work a lot with Share Action on that. And so why do we look at these two areas? They are for us. We see them both as systemic risks, and they are, as a universal owner, we are impacted across multiple sectors. So in that sense, for us, it becomes very relevant to be involved and engaged and push our our companies on that. If to sort of evidence what the financial impact is, if you look at AMR, for example, in 2014 there were 700,000 deaths due to AMR. That was an estimate that was done in the UK, with the projection that death rate would go up to 10 million deaths in 2050. Now, unfortunately, that trajectory has recently been confirmed in a study that was published in The Lancet in the beginning of the year, where the GRAM project had looked at data from basically all countries in the world and confirmed that in 2019, we have seen 1.27 million deaths due to bacterial AMRs, right? Bacterial antimicrobial resistance. And so if we compare that to the deaths that we've seen during the COVID pandemic over 2 years, that's about 7 million. And if you see the projector being up to 10 million, that's a significant amount more of deaths as we see. And if you look at the impact that has had, the COVID pandemic, we can draw parallels what would happen to the economy if that death rate increases. And the World Bank has done estimates on that, where they have calculated that 3.8% loss in GDP is due to the impact of AMR. So that's quite significant, and that is why we think as Elgin that this is an area that we need to look at much more. When you come to nutrition, and so there in particular we look at obesity, and there again going back to the data, if you look at what the World Health Organization has estimated in around 2018, about 40% in the US of the adult population is obese. A recent House of Commons report from this year has estimated that 28% of adults in England are obese, and about 1 in 4 children of the age of 11 are obese. Now, why is this an issue? Because it has health impacts, both if you look at heart attacks, diabetes, and other coronary diseases. They are quite strictly linked to levels of obesity, and that impact on the economy is quite significant. So OECD has estimated that 8% of OECD countries' health expenditures will be dedicated to treating obesity and the related diseases to that for the next 30 years, and that will have an impact on us as investors. So what do we do? So I'm giving you a very long answer. So what we're doing in that, so we work with the companies in which we invest. We work on a policy level on these 2 areas. We do that individually as Elgin, but also collaboratively. For example, with Chair Action, but also the Access to Nutrition Initiative as well, and the Access to Medicine Foundation in the Netherlands. And I think that combination of individual engagement, what Tembeke was mentioning before, the importance of that, but also going together as a group of investors. So that was a very long answer.
Thank you. Jessica, what are the big social issues that Share Action would like investors to start tackling or focusing on?
Yeah, I mean, you'll be not surprised to hear me say health. Health is one, and Maria's outlined lots of really good reasons why investors should be starting to think about health. So we did lots of research last year that really looked at what's the opportunity? Is there a need for health to be a focus for investors? And how can we support investors to really do that in a meaningful way? And I suppose what we found when we interviewed lots of different asset owners and asset managers from around the world is that health poses a real blind spot to investors in general. And so what that means is that portfolios are at greater risk than they may recognise, and that they're not always taking them sort of mitigating steps that they could be to reduce their risks from poor health and to improve their impact on people's health. So we see, particularly off the back of the pandemic, we see health as a real area of growing momentum. We know that good health across the population is the bedrock of a thriving economy and a prosperous population. And we're really keen for investors to embed a greater thinking about health into their work and really considering health quite holistically. So we know that there are patches and piecemeal bits of really good health-focused work on nutrition, on antimicrobial resistance, on vaccine equity around the world, but there's also huge gaps. So we're encouraging investors to think about health using a sort of three-pillared framework, which intentionally mirrors the three climate scopes. So pillar 1 is all about worker health. So what are all the things that a company can do to support their workers to stay healthy and to stay well? The pillar 2 is about consumer health. So what are the products and services that are being manufactured, sold and marketed by that company, and do they support good health or harm health? And then pillar 3 is about community health. So that's really thinking about what are all the things that's thinking about sort of polluting effects from companies. So think of air quality, for example. But it's also thinking about how can investors and companies really instill and drive good health right throughout the supply chain. So we're really keen that investors start to think more about this. We know that at the moment, our health in the UK and far beyond is not where it should be. And just to bring that to light, in the UK, only 1 in 10 men will retire with good health. And so that means that a huge proportion of people are prematurely exiting the labour market. We see stats modelling that shows that a third of the productivity gap between the north and the south in the UK is as a result of health disparities. And so this has a huge impact on companies' productivity. It has a huge impact on their ability to access a skilled workforce. So we'd really encourage investors to take this up as an issue, and we've launched a new programme called the Long-Term Investors in People's Health Programme, which is designed to support investors to do just that. So we'll be ensuring that there's good data, good insights. We'll be supporting investors with guidance and toolkits and collaborative engagement opportunities to really enhance their impact on people's health.
It's all very interesting, the whole discussion about health, because of course there's been I'm right in saying there's been no new antibiotic created since the 1980s, is that correct?
There are, yes and no. I would say there are more new ones coming out, but they're way too few than we would like to see. I think one of the latest I've read is GSK, so GlaxoSmithKline would have something coming out, and there is a fund, not they call the AMR Action Fund, that's set up by multiple pharmaceutical companies, and the aim is to within 2030 have 2 to 4 new antibiotics out in the market, and so they provide funding to smaller startup biotech companies and R&D companies to ensure that there is some kind of pipeline coming through. But there is a serious issue. If you look at the number of pharmaceutical companies that do R&D in antibiotics, in the 70s you had about 30. You have 4 now that do that.
Okay.
That's better. And I think many times what we forget about antibiotics is it is what is the foundation of what we see as modern medicine. You can do very little with modern medicine if you don't have antibiotics there to sustain you. Think of your hip implants. Hopefully you don't have to think about that, but your elderly parents. If you have to do chemotherapy, if you go to the dentist, have an abscess, for example, that is cured with antibiotics, and if you don't, it can have very serious impact. If you look at the beginning of the 20th century, the majority of children who died under 5 were due to infectious diseases. That was the leading cause of death up until you were about 30. So it really is the bedrock of our modern medicine. cheering news.
Exactly. Yeah. Bika, is making an impact just for a long-term strategy?
Yeah, that's an interesting question. I think yes and no. Clearly, when someone is investing in impact, there has to be a level of long-term thinking in mind. So if I'm investing in an affordable education company and I'm trying to understand the impact that has been generated, clearly the impact for a child of getting affordable education might take decades for me to truly understand what they were able to do with it over time. So there is some level of long-termism rather, that's needed when thinking about social impact and investing in social impact. However, at the same time, there are also a lot of mature companies that have been creating social impact over decades already. So in terms of being able to evidence the impact that has been created, it's already there. So short-term capital can also go in and be able to invest in that, understanding that the outcomes have already bear fruit, or the companies have evidenced the impact that they've generated from being in operation within their societies. I think as well, in general, there's this misconception that when we're thinking about social impact investing, you either have to wait a long time to get the returns, or you might not get them at all. So essentially, there's this idea that it's more philanthropic, and that's not true. In the years that we've been running our impact fund, you find that the social impact itself could be the moat that the company has. And so by having a strategic alignment to that social impact, you have a situation where these companies are becoming more profitable by increasing that impact. So the more people they reach, the more profitable they become, and it really marries that profit for purpose element to it. And so yes, sometimes you might have to be patient and wait for that to bear out, but there are also plenty of examples where companies have been doing this already, and actually represents good investment opportunities for short-term investors as well. There are also smaller companies, perhaps with more nascent business models, that are having more of a disruptive role to play in the industries that they're in. And that's where you're also seeing a lot of growth potential come through. Again, that can become attractive to both long and short-term investors. So I don't think it's just something where we should just look at it and say, this is just for someone who's trying to do good, sacrifice returns and wait a long time to get returns. I think there's plenty of opportunities to do it as well from a short-term investment perspective.
Okay.
And that's what we found in running the impact funds at M&G.
Thank you very much. Thank you. Maria, of course, investors, of course, want to make a social impact, and wanting to do it and put money into something is all very well, but how easy is it to measure outcomes?